Thank you all for joining me. We have identified nearly 1,000 new COVID-19 cases since yesterday. This virus is spreading rapidly. It's in every corner of our state. It's gotten into our nursing homes and our prisons, and it's filling up our hospital beds. Every day we wait, the coronavirus spreads further and becomes more difficult to suppress. So we need to act now. So today, I'm extending my stay-at-home order across the state. Regardless of where you reside in Pennsylvania, you should not leave your home unless absolutely necessary. This stay-at-home order will remain in place until April 30th. The Surgeon General is recommending stay-at-home across the nation, and the states surrounding us have put into place similar orders. I have already implemented some of the strongest business and public space closures in the country, and I've seen good compliance with residents already under my stay-at-home order. I am optimistic that people across the state will comply and remain in their homes. People have already stepped up to make it easier for others to stay at home. Attorney General Josh Shapiro has instated a ban on evictions, helping Pennsylvanians keep a roof over their heads during this crisis. Volunteers are using a no-contact system to deliver food to vulnerable neighbors. Teachers and school staff are packing and delivering lunches to ensure children are getting enough to eat. We Pennsylvanians want to survive, and we want our friends, our family, and our neighbors to survive too. We want hospitals that aren't overwhelmed so everyone who needs treatment can get it. We want to get through this as quickly but as safely as possible so we can restart our economy and get back to work. And so we will all work together in this. It's our only choice. Some of you might think that a month is too long to go without seeing your friends or family. But if we don't do everything we can to slow the spread of COVID-19, there are some people who you will never see again. 74 people in Pennsylvania have already lost their lives to COVID-19. And it's up to us to decide if we're going to let that number skyrocket. Do we want 740 families grieving for COVID-19 victims? Do we want to sit idly by and let that figure climb to 7,400 or 74,000? As we've seen in places like Italy, if we don't do everything in our power to stop the spread of this disease, we could easily have a death toll in the thousands. We have the gift of this disease reaching us late in the day. We know if we implement strong mitigation efforts, we can halt it in its tracks. We can stomp down that curve. But we all need to work together. Please assume everyone has the virus, including yourself. Avoid leaving your house like someone's life depends on it, because ultimately someone's life does depend on it. And please do not panic shop or hoard food. All parts of the food supply chain will remain open throughout the duration of this crisis. This includes grocers, food banks, food pantries, and agricultural production and processing. Buying more than you need for a week or two at the grocery store adds unnecessary stress to the food supply chain, and it limits available products for others, including charitable organizations. So please only buy what you need when you're at the grocery store. Do it for the hardworking grocery workers, for the food banks and their volunteers, the farmers and truckers, and the many Pennsylvanians out of work and who are relying solely on a reliable charitable food system. This next month will be difficult, but we Pennsylvanians are strong. We will get through this together. Thank you. And now I'm going to pass it on to Secretary Levine.
Thank you, Governor, and good afternoon. As of 12 a.m. this morning, we now have 962 new cases of COVID-19, which brings our statewide total to 5,805 Pennsylvanians who have tested positive in 60 counties. Approximately 286 of our total cases are in healthcare workers. Approximately 200 of the confirmed cases are in nursing homes, numbering 92 across the state. More than 620 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. This is still about 10% of the people who have tested positive for the illness, COVID-19. As the governor mentioned, tragically, we have had 74 deaths among those who have tested positive for COVID-19, and to date, all of the deaths have been in adults. I understand that staying home is not easy, but this statewide stay-at-home order from the governor is not just to protect ourselves from exposure to COVID-19, but it protects those on the front lines, our doctors, our nurses, our police officers, our fire officials, and emergency medicine technicians, our EMTs and paramedics, need us to do this. Nurses' aides who are taking care of family members in nursing homes or long-term care nursing facilities need us to do this. We can't afford for them to get sick, and we certainly can't afford for them to spread the virus to the people that they are caring for. I know that staying home for a month is really difficult, but please do not make a daily outing to the grocery store or the convenience store. Please go when you need to go, because staying home means staying at home. Staying at home is the only way that we can slow the spread of COVID-19 through our communities and through our Commonwealth. Staying at home is the only way we can protect those on the front lines who are caring for our loved ones in hospitals and nursing homes. So please, stay calm, stay home, stay safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially after touching surfaces. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember, stay calm, stay home, stay safe. And now I believe the governor and I will answer questions.
Thank you, Secretary. Governor, the first question is for you. From ABC 27, can you talk about the state's efforts to solicit donations of medical masks and supplies from private companies across the state? How has that been going, and have businesses been responding to the requests?
We're actually trying to buy as well as receive donations from businesses across the state and individuals as well, and we'll do more on this in the future. Right now there's a shortage of masks, but there are different masks that are being made for different settings. There are masks that you can wear when you go about your daily business. It keeps others from getting infected if you're at the food store. There are masks that can be helpful for the safety of workers in our county assistance offices. There are masks that can be used for people working in long-term care facilities, and then there are the surgical masks that people or healthcare workers need in hospitals. So we're working diligently every day, every hour to try to get more of these masks, and we will continue to do that, whether it's by donation or purchasing them.
Governor, a couple of questions about enforcement from Spotlight PA and the Lewistown Sentinel. What guidance are you giving state police or other local law enforcement agencies about enforcing the stay-at-home order? Should they stop people who are out and ask them why they aren't home, or question groups of people who may not be practicing social distancing? Are you recommending that law enforcement simply provide warnings, or do you think that there should be a more serious consequence?
At this point, we're focusing the state police efforts on business closures, and it strikes me that, as I said in my comments, that all of us have a vested interest in staying at home. We're keeping others safe by doing that, and we Pennsylvanians, I think, are going to be doing that voluntarily. That's what's happened in the counties that have had the stay-at-home order, as I said, and I don't expect that we'll see any difference when it comes to people, individuals, citizens, staying at home and doing this because they know it's the right thing to do.
Governor, from the Pocono Record, are there any plans to shut down the short-term rental market in PA, being that communities such as the Poconos have shown concern that residents from out of the area or state are coming there to escape to the areas where that have been heavily hit by COVID-19?
Yes, we actually did that yesterday. Shut down short-term rentals like Airbnb in the Northeast, and I want to thank the legislators on both sides of the aisle and both chambers were very helpful in bringing this to my attention, and I think we reacted very quickly to that. There is nothing that's essential about a short-term rental in the Poconos, and so we have shut them down.
Secretary, the next question is for you. From the Altoona Mirror, given that a CDC official said that up to 25% of positives are asymptomatic, should the department consider testing without symptoms?
So right now we have a number of different testing facilities available. One is through our state laboratory, and we're prioritizing patients with symptoms who are very vulnerable, or vulnerable citizens such as in nursing homes, or also healthcare workers. And then hospitals and health systems and medical facilities throughout the state are doing the vast majority of the testing. They are sending those samples either to their own laboratories, their own hospital laboratories for processing, or sending them to the commercial laboratories such as Quest and LabCorp. We know that there has been somewhat of a wait in terms of getting those results, but we have recent data today that's not perfect, but it is improving, and there's a shorter wait time to get those results. Finally, there continues to be the mass testing sites in Philadelphia and in Montgomery County. However, even though we have worked to expand testing throughout the state, we do not have the capacity to do population-based testing and test non-symptomatic individuals. So I know that there are concerns about people who are either asymptomatic or pre-symptomatic, meaning before they have symptoms, potentially spreading the disease, but there is not the laboratory capacity really anywhere in the United States to do that type of population mass testing of large groups of people. And so maybe sometime in the future, but not at this time.
Secretary, from Penn Live, what is the department's guidance for EMS companies concerned about their supplies of personal protection equipment or funding to stay operational during the epidemic? Do you have any guidance for maintaining ambulance staff as EMTs are diagnosed positive?
Well, so our EMTs and EMS agencies are absolutely critical during this global pandemic of COVID-19. So we'll do everything we can to help them. We will provide EMS officials with and EMS workers with personal protective equipment. In addition, we'll work to make sure that they continue to be funded. Yes, if an EMS technician is positive for COVID-19, then they will need to be isolated and will need to track their close contacts for quarantine. That can put a strain on EMS agencies, and we'll work with the counties to maintain their functions and make sure that EMS capabilities are available anywhere in the state.
Secretary, from the Scranton Times, most of the cases in Northeast Pennsylvania are coming from Luzerne, Monroe, Lehigh, and Northampton counties. Any idea why? Luzerne seems particularly concerning given that it's further away from the border than the other three.
Well, we are seeing, as the governor said, community spread of Pennsylvania throughout the Commonwealth. And so it's hard to know exactly why certain areas are higher than others. Of course, the area that's been most hard hit is the southeast because of the population density. So we will work with the counties and try to do a deep dive into the data. But COVID-19 really is present everywhere in Pennsylvania, and there is community spread, which highlights the extreme importance of the governor's statewide stay-at-home order. This type of prevention and mitigation efforts is critical to prevent the spread of COVID-19 and prevent a large peak of wave of cases which could potentially overwhelm our healthcare system. So the most important thing, as we've been saying, is please stay home.
Governor, the next question is for you. We have two reporters from NBC 10 and Public Source asking about schools. Schools have been closed for weeks, and many online platforms that schools are using are crashing, making it difficult for parents to teach and work from home. What are your plans to address the critical needs of online learning?
So we actually set up guidelines for online learning just yesterday. And so to the extent there are problems, we will do everything we can to make sure that we are providing students, families, parents with the educational opportunities the students need while they're not in brick and mortar schools to make sure that this distance learning, this online learning option works effectively.
And Governor, from WTAE and Fox 43, they have questions about unemployment claims. We're still receiving calls that residents cannot get in touch with the state unemployment office. Has your office been alerted to these problems? And what can you do to ease the problem for unemployed Pennsylvanians?
Yeah, the unemployment compensation system has been overwhelmed. We have a lot of calls, I think since March 15th, close to 1 million new claims. So we're doing everything we can to increase our capacity to respond quickly. We have been overwhelmed by the new claims, but we are tracking this at every hour, and we are doing everything we can to make sure that we're turning this around as quickly and efficiently as possible. We'll continue to work on that throughout this whole process.
Governor, from WGAL, is Pennsylvania contracting with third-party sources like Ford and Gap and other companies who are shifting their manufacturing efforts to make things like ventilators and masks?
No, the Defense Production Act has actually allowed the federal government to work with these big national companies. There are some of them in Pennsylvania, and we've contacted them, and they are primarily working through the federal government procurement program. So the defense, the act to actually stand them up, to get them to transition into doing and making things that are going to help fight this epidemic are actually being handled and coordinated at the federal level.
Secretary, the next question is for you. As we speak, Elwood City leaders are holding a virtual conference about the Army Corps of Engineers and local leaders looking to reopen the facility during this crisis. Can you comment on this?
Well, so we are looking at many facilities, including Elwood City, to be able to deal with the surge of patients that we anticipate. And again, the best way to prevent the surge from being overwhelming are the stay-at-home orders that the governor has instituted throughout the state. So the Army Corps of Engineers will go into a hospital and evaluate how well it could take care of patients, either COVID-19 patients or other patients, allowing our present facilities to take care of them. We really need to strengthen the entire healthcare system with the whole continuum of care. That includes ICU beds, that includes infectious disease beds, that includes regular what I call medical surgery beds, and then subacute facilities. And that could include even hotels where patients who are subacute coming out of the hospital can convalesce. So we're looking at that whole range. We will be looking at Elwood City as well as other recently closed facilities.
Secretary, from News Talk 104.1, what would someone do if they work for a medical provider and that medical provider won't supply a mask?
Well, it kind of depends what type of medical provider. If it is a hospital, an emergency department, or an office that are seeing possible COVID-19 patients, then that individual really needs to have the correct personal protective equipment, and they should talk with that healthcare with their boss and discuss that and make sure that they get what they need. I guess if there's a concern, then I would contact, if possible, the Healthcare Coalition, or even contact one of the county municipal health departments or our health department. But I think the best thing is to go to their boss and to evaluate what their risk really is. There are many healthcare providers that might be taking care of other people who we do not are not showing symptoms of COVID-19, and so the PPE would vary according to the risk.
And then as a follow-up, News Talk 104.1 has a question about extra precaution measures being put in place for those moving patients who have succumbed to COVID-19. Are funeral directors required to wear extra PPE when dealing with a COVID case?
So there are specific guidelines on the CDC website, and our website will link to it, for funeral directors. And we have been working with our excellent coroners and medical examiners, and we'll have guidance coming out this week for them as well. Depending upon the situation, they might require PPE or they might not. So those guidances are either available now for funeral directors and coming out soon for coroners.
Secretary, from Penn Live, regarding the growth in case numbers over the past week, can you tell how the recent results match up against your best case, worst case modeling scenarios? Mm-hmm. Are we closer to the best case, worst case, or just in the middle?
Well, so we're continuing to work on that modeling with the University of Pittsburgh School of Public Health. And, of course, the modeling, as I mentioned a day or so ago, is very complex, and it really depends upon the variables and the assumptions that you make. Assumptions such as how many people will one person with COVID-19 possibly transmit the virus to, et cetera. So we're kind of working to perfect that. Our most recent data, we have more discussions with them this week. And we're watching the daily trend of cases really, really carefully. So it's too early to draw specific conclusions. As the governor mentioned, we are continuing to see an increasing number of new cases, which is of concern. But we are working on these mitigation and prevention efforts to prevent a rise in patients, a surge of patients that could potentially overwhelm the healthcare system.
Governor, the next question is for you. From WGAL, will the stay-at-home order be phased out? Is there a concern that the virus is still here and easing restrictions could leave Pennsylvanians vulnerable?
Yeah, right now, the primary concern is to keep people safe right now. And that means we need to have fewer people coming into contact with other people. The stay-at-home order has actually done good things to mitigate the spread of the virus, and as the Secretary said, that's why I've extended it across the state. We do keep looking at different models to see where we stand, and all of them say exactly the same thing. How fast this disease takes off depends solely on how well we do staying at home. So I think we need to decide to stay at home. And the more we do that, the better we enforce this ourselves, the better position Pennsylvania is going to be in terms of keeping ourselves safe.
Governor, from Public Source, do you urge Pennsylvanians to opt in for mail-in voting for the June 2nd primary rather than going to the polls in order to combat the spread of coronavirus?
Yes. I think that would be a really good idea, and we have a lot of applications coming in, people who want to take advantage of the new mail-in ballots.
Governor, we have a question from Penn Live and Bucks County News regarding state liquor stores. Some readers suggest that they could shop at a state liquor store just as safely as they do at the grocery. And given that all of our neighboring states are still permitting liquor sales, do you think we have it wrong on liquor sales? And how close are you to making any modifications? I
actually have made a modification. Our liquor stores are closed, and I think that's going to be good for our employees in the liquor stores, and it's also going to be good for the patrons. It's one less place that disease can be spread. But in the meantime, we have opened up online sales, so you can use the online service, and that is the way to buy liquor during this crisis. That's the safe way to do it, and that's how we're doing it in Pennsylvania.
Secretary, the next question is for you. From Lehigh Valley Live, are we seeing the flattening of the curve with regard to new cases?
So, as I was mentioning before, we're watching the rate of new cases really, really carefully. We have seen this week that it has continued to go up. It's too soon to draw any conclusions whether it's flattening or not. We'll be comparing those with the models that we get from the University of Pittsburgh, as well as other models, and we're going to be observing and taking the measures that the governor mentioned to try to continue to do that. It is critical, as I've been saying before, that we follow the mitigation and the prevention efforts and the stay-at-home orders. All of the models, as the governor said, are very dependent upon that. And if we do not do this correctly, then there's going to be a significant surge of patients. And if we do it correctly, there will be a much smaller surge that we can deal with in our healthcare system. So the key thing to remember is follow the governor's orders and please stay at home.
Secretary, from the York Daily Record, it is taking some people more than a week to get their test results. Is it possible that the results could be affected if it takes that long for the test to be completed?
No, it doesn't impact the results. It doesn't impact the accuracy of the results, but we don't want people to wait a long period of time to get the results. It's very anxiety-provoking and difficult. We want them to know as soon as possible. And so we have been working and reached out to Quest and to LabCorp and have evidence that the length of time, the wait time has decreased. It's still too long, still up to 3 or 4 days, but it's better than it was before, and we'll be continuing to work with them and contact them to try to decrease that even further.
Secretary, from Penn Capital Star, Pennsylvania's testing rate is lower than the national average and middling compared to other states. Is there any fear that testing capacity could hamper mitigation efforts?
I don't think that the testing capacity would hamper the mitigation efforts. The purpose of the mitigation efforts is for people to stay at home to stop the spread of disease. We have increased the capacity for lab testing throughout the state. We continue to be able to access the resources and the reagents necessary, but we are not able to do anything like a population-based testing, and that's not really being done anywhere significantly in the country. We'll continue to ramp up testing as much as possible given resources.
Governor, the next question is for you. From Penn Live, what is the likelihood that with the problems schools are having in getting their educational programs up and running, what's the likelihood that you would consider letting students who had passing grades before schools close be promoted to the next grade level or graduate?
Yeah, I think the Department of Education is looking at that and other things. But as I said, the big thing right now is to make sure that we're doing what we can to provide an education for the next couple months for students. We have extended the time that students are not in school indefinitely. In the meantime, we recognize that we have got to do something to make sure that those students are getting the education that we need them to have. And so, as of yesterday, we stood up the continuity of education process, new programs, and we will continue to do everything we can to make sure whatever problems exist in that system, that we'll address them and make this new system work well.
Governor, we have two questions from WTAG regarding the essential business list. Will this statewide order have any impact on that statewide business list as far as essential and non-essential businesses? And are there any modifications being made to the stay-at-home guidelines for residents now that it's under the entire state?
The second question, the guidelines for the entire state are exactly the same as the guidelines for the counties that have the stay-at-home order right now. It's stay at home unless you have to go out for something that is absolutely life-sustaining, like buying food or pharmacies, going to the doctors. You can also go outside if you practice social distancing, to exercise, to enjoy the outdoors as the weather gets nicer. So the new statewide stay-at-home order is exactly the same as the stay-at-home orders that have been in place for, I think, 80% of the population of the state right now. So that doesn't change. And give me the first question again.
In terms of, has the order changed any issues with the essential, who is essential and who is not an essential business?
Sorry about that. Yes, it has not changed that at all, and we continue to use the same list. We do have the waiver program, but the same list of business closures. Again, all this comes down to keeping people safe. To the extent businesses are not providing an essential service, they need to be closed. This is what's fair for their customers, for their employees, and for all the rest of us. If we're going to bend this curve, we're all going to have to work together, businesses, families, individuals, and that's the only way we're going to defeat this in Pennsylvania. So what I'm doing is extending the stay-at-home order, and I'm not changing anything else.
Thank you, Governor. That's all the questions we have time for today. For reporters whose questions we were not able to get to, the Department of Health and the Governor's press office will follow up with you. Our next press briefing will be tomorrow. Thank you.